We begin with the horror of a story coming from Goa. 75 patients dead in just 4 days, all at one hospital. In fact, the city's biggest COVID facility over there, the Goa Medical College and Hospital. How did this happen? Well, apparently due to logistical issues in the supply of medical oxygen. Mind you, not the supply of oxygen altogether, not the shortage of it, but logistical issues that have taken up 75 lives. 13 dead reported on Friday, 15 on Thursday, 21 on Wednesday, 26 on Tuesday. What's common here, apart from just the hospital itself, is that all these deaths happen between 1 a.m. to 6 a.m. in the morning. How is this happening in a place like Goa is something that is extremely baffling at this point. No clear answers just yet. And all this as the judicial system continues to ask Goa some very hard-hitting questions, but lives continue to be lost. Horrible and disturbing pictures really over there in Goa, and what's shocking is that lives continue to be lost day after day. What exactly is going on over there? Let's get in a word from Dr. Joseph first. He is a former consultant in the pediatric intensive care and was in London. Now he is a very active Goan, talks about loads of issues in the area. Let me just get to the heart of the issue with you, Dr. Joseph, first. What exactly happened? Last time we tried to get some reports from there, we were told that this is that time between around 1 a.m. to 6 a.m. or 2 a.m. to 6 a.m. when the shift change happens. Change of shift for 4 days has taken 74 lives. This is unbelievable.
Sonal, thank you very much for giving me the opportunity to add my voice to this dialogue. It is the biggest crisis Goa faces since it got its independence in 1961. It's a small state, just 15 lakh is our population, 1.5 million, but it has the highest per capita GDP in the country. Unfortunately, there is no easy answer. There are no easy solutions. There are no magic bullets. One of the things we are taught in medicine, in intensive care, is that whenever a patient crashes, whenever there's a crisis, one has to call for help. And therefore, what we do need to do now is not just call for help, shout for help. From the center, from the neighboring states, from the army and the navy that has significant presence and infrastructure here in Goa.
Okay.
And that said, Sonal, sadly, we will never have enough oxygen. Not just as a state, but as a country. We will never have enough hospital beds with oxygen. We'll never have the medical personnel to handle not just the surge in this pandemic crisis, but the next one.
Can I interrupt for a minute? You're talking about an overarching picture over here. I just want to understand first up, what happened at that hospital? Do you have some insights into what took place? In fact, I'm told I'm joined by Ashley on the phone line. I'll just come back to you. I'm joined by Ashley on the phone line. He is a relative of a patient who was there and a volunteer as well at that hospital. Ashley, can you tell us what exactly went wrong in the hospital?
Yes, so my relative has been there in the hospital since last month right now.
Okay.
And but however, he's been on the ventilator, and it has been, even though the media has highlighted just 4 days, it's actually been closer to almost 10 days where this scenario has been playing out, wherein there was a lack of oxygen. I don't have the exact numbers for the previous days, except for now these last 4 days. But we do know that they came to a point where we realized that every night at the time something was going to happen, and we stayed on tenterhooks because the moment something happened, we used to scramble to search for cylinders. We used to help the nurses to connect 2 or 3 patients using IV lines to connect it on the same cylinder. So then they came to a point where we said enough is enough. When one night the entire ward ran out. It was not just a few people, and that's when we alerted the authorities and we started shouting it out on social media, trying to get people's attention, and it came up to this point.
So what exactly happens every day during the shift change?
So there are a couple of things that we can I have assumed during the little time that we have spent here. Number one is there's a huge manpower shortage at that point of time. This particular hospital has it's a 4-story hospital. This block, there are 3 wards on each floor, and it is mainly the top floors, the 3 wards on the topmost floor, which have the problem. So, it's not only just the oxygen cylinders running out. Maybe there's not enough pressure to reach the top, but also at that point of time. Now, of course, it's a little more different. But at that point of time, when people used to crash, there used to be just 2 or 3 personnel bringing cylinders for the entire 4 floors, and it was just not enough. When each floor had each ward had nearly around 100 patients.
Right, shocking details, really. Ashtu, thanks so much for giving us an insight into that. Let me go back to Dr. Joseph over there. So, Dr. Joseph, there seems to be a case where they're simply not being able to manage this. I want to understand under whose authority does this hospital come in, and where does the buck stop here?
So, Sonal, I think you need to pose those questions to the hospital administration. What I can say as a pediatric intensivist, that's a pediatrician who looks after critically ill children, I haven't seen in my career this phenomenon. We've looked after patients with multi-system failure, with acute lung injury, and in the absence of an interruption in oxygenation, in the interruption of ventilation, of power supply, I cannot understand why this should be happening. There is no pathophysiological reason of COVID lung injury that can explain this. So I'm just as perplexed as you are.
I'm beyond perplexed. I'm really angry and enraged right now. What exactly is happening over there? We have Pikiri Nambiar joining us, and also Rahul, who's a convener for AAP in Goa. Pikiri Nambiar, I mean, this is unbelievable. 74 lives lost, not because of lack of oxygen, because somebody is not being able to fix the problem. For 4 days, people are continuing to die.
Sonal, it's really shocking. I mean, seeing these visuals and itself is so much of a shock to anybody whomsoever is watching this program. But imagine the people who are going through their families going through the plight. But then we all, as the doctor said, we are all living in a condition today that one after another place like Goa, as a very progressive state, is also going through. So I believe that there is a system failure, whether it is from the government side, even the bureaucracy side, even in the medical side. Like for an example, a government cannot do too much within the hospital. Once you have a patient, it is the health authorities or the doctors and the paramedics who is supposed to look after them. But in the meantime, it is the duty of the government to make sure that there is an oxygen supply.
I'm very happy you're talking about that, because I have some research now coming to me which says that this hospital was established in 1842 during the Portuguese rule and renamed the Goa Medical College in 1963. It is one of the oldest medical colleges in all of Asia, mind you. The college is under the Goa University since 1986, before which it was under the Bombay University as well. So the Goa Medical College Hospital, which now has its headquarters over there, is, has been in place for quite some time. So this is clearly under the Goa government, if I'm not wrong over here.
No, I believe that it is true that the government, of course, we all look up to the governments, whether it is in state or in the center, there is no doubt about it. But then everything can't be, every buck cannot be standing at the doorstep of a chief minister, and you can't say that everything needs to be answerable or a criminal action needs to be taken against the chief minister. I think there should be an impartial inquiry on this. No, that's true. See, there is no a single person whom you can blame on a pandemic time and a situation like this. What can we do?
I'm told I have limited time, so I want to bring in Rahul also for a quick reaction. Rahul, who's at fault here, please?
So I'll tell you, we have got this health minister, Mr. Rane, who is health minister for last 10 years in the Congress government and now in the BJP government. We have been warning that the health system is collapsing, particularly on the oxygen side. But the government took no action. It brushed everything under the carpet. So the 74 deaths which are there, I call it murder. And the blame entirely lies on the Chief Minister of Goa and the Health Minister, simply because they were warned to take action to provide oxygen. But all they did, made public statements saying that we have got ample of oxygen, there's nothing to fear about it. So when the time came, the Chief Minister visits the Goa Medical College just 2 or 3 days back, after more than 800 people have lost their lives. He doesn't have his health minister along. They are just doing a blame game at this moment in Goa. And I fear as the night progresses today, how many more, I hope not, but I'm not sure whether they'll get the oxygen today itself also delivered at the Goa Medical College.
My
It's
God.
a very pathetic state out there, Sonal.
One quick rebuttal.
My God, I really am just trying to make sense of what you're just telling me. You're saying it is still not fixed. It could just be the case tonight as well. That's shocking. We're going to have...
Yes.
We're going to have a colleagues check up on that front. I'm sorry I'm out of time. I would love to come back for a rebuttal, but what is there really to say in this case? I think, where is the administration looking into this matter? How can you have this going on for 4 days at a row, 5th day also on tender hooks like this? Well,